All right, let's go. Okay, well, hello everyone. It's great to have you all here. Welcome to this webinar. My name is Marta, and I'm the global focal point for migration at the UN Major Group for Children and Youth. It's my pleasure to welcome you in this webinar today on behalf of UNMGCY. We co-organized this webinar today with IOM and with our partners at UNICEF, UNFPA, and the Youth Envoy, as well as different youth networks, working groups, and organizations who joined these efforts and made this possible. So with the COVID-19 pandemic and the crisis, a great majority of discussion spaces have been canceled, including those for youth, such as the UN 75 Youth Plenary and the ECOSOC Youth Forum, the primary avenue for youth engagement in the UN Economic and Social Council, with a formal feeding mechanism into the high-level political forum for advances on the Sustainable Development Goals are reviewed each year. For this reason, we decided to pivot and create an engagement space, this webinar, in order to ensure we could still give an opportunity to youth to come together and discuss key topics in relation to this year UN 75 and HLPF themes. Therefore, we're here today to consult on the important topic of youth on the move, and in specific regarding the themes of COVID impact and response, health risk and opportunities, and the role and potential of technology, innovation, and technology for populations on the move. The outcome of this discussion will feed directly to the youth position on the UN 75 process and the voices of youth from ECOSOC to HLPF paper, which will be presented at HLPF and will be a supplement to UNMGCY sectoral paper. So your conversation today will be heard and recorded, and from the youth inputs for these processes and discussion. We're looking forward to hearing what you have to say and share your experiences, the challenges you face, and initiatives you're part of. We're going to hear now from 3 keynote speakers, and then I will share some logistical notes for the breakout sessions, which will start in around 30 minutes after these openings, just straight opening ceremony. We'll have to stay after the opening in this Zoom room, and we'll be sorted out according to like the number right before your name. So more on this later, but yeah, let's just start now. It's now my pleasure to introduce the first keynote speaker. Her name is Corina Muskus, and she's a Venezuelan migrant and a women's rights activist. She's a lawyer from the Universidad Católica Andrés Bello and holds a master's degree in international legal studies at American University Washington College of Law, where she specialized in human rights and gender. She worked as a Rómulo Gallegos Fellow at the Inter-American Commission on Human Rights. She's the co-founder and director of Venezolanas Globales, a platform that gathers and empowers women from the Venezuelan diaspora. She has extensive experience on the issue of gender and migration, and she recently conducted a research study on violence against women suffered by women and girls from the Venezuelan diaspora with the NGO CEPAS. Marija, you have the floor.
Thank you very much, Marta. Hi, everyone. Felimar Luque is a doctor, a Venezuelan gynecologist that migrated to Peru. Her dreams to keep performing her duties as a doctor were shattered once in Lima, where she sold arepas, Venezuelan typical food, in a street market with her sister. For more than a year, she dreamed of coming back to a hospital, and what was a terrible crisis for some became an important opportunity for her. As a consequence of the COVID-19 crisis and the lack of health professionals, she is now working in the most important social security hospital of Peru. When discussing the COVID-19 and the migration crisis, we must not forget that medical doctors, nurses, and healthcare professionals are migrants and their jobs contribute greatly to society, health, and development. This is also an example on how states can accomplish much when they let their migrants regularize and use their skills to benefit the community and the country. We shouldn't need a pandemic for examples such as Felimar to practice her profession in other countries. Good day, everyone. My name is Corina Muskus. I am a Venezuelan woman and a migrant. These two identities inspire me to create Venezolanas Globales, a platform that gathers and empowers women from the Venezuelan diaspora. At the beginning, we were just a few Venezuelan women connected on a Facebook group. 2 years later, we are a community of more than 2,000 Venezuelans and 19 ambassadors in more than 14 cities in the world that organize meetings and discussions with women from the diaspora. Venezuelans are migrating due to a terrible humanitarian crisis, And we will also like to be recognized as migrants that provide an added values to the local communities. As a young representative of this forum, I would like to recognize the work of the young and empowered persons from the United Nations Major Group on Migration and Development. As youth, we are currently demonstrating our resilience and our strength in the face of adversity. Youth has been leading responses everywhere. The UNMGCY is currently mapping youth-led and youth-focused initiatives responding to the crisis. And in my speech, I would like to recognize a few of them related to health and technology in order to show the importance of youth voices and the impact their actions have. First, the initiative Youth for Peace International, which creates a safe space for young people to practice mindfulness and self-care during this crisis. They have created an online space to stay connected and facilitate, share mindfulness practice sessions with the group. Projects like Code Weekend, which helps children and youth to continue education and learn new skills. Coding will help youth and children in their future and keep them busy during this pandemic, of course, if they have access to the internet. Another example is the Youth Alliance for Safe and Healthy Homes Suriname. The answer of the majority of the states has been to stay home, but what if home is not a safe space for women and children? The increase of child abuse and domestic violence has been a key issue during this pandemic, not because it did not happen before, but because the pandemic escalated this problem. This inspired 4 youth members that acted upon this issue and are heavily involved in sexual and reproductive health and rights, anti-violence movement, and 2 other members who have great track record on gender-based violence. As a consequence, they created Youth Alliance for Safe and Healthy Homes to raise awareness against violence. These projects recognize vulnerabilities and work in favor of them. The states must do the same and recognize structural discrimination and challenges that a person faces if they're young, but they're also a migrant, or a woman, or a person from the LGBTI community. These communities face particular vulnerabilities, and it's important to address their needs when developing policy changes and decision-making, listening to their needs. For example, decisions of segregating men and women on alternate days had an enormous impact on the LGBTI community, in particular trans and queer community, and the community of migrants afraid of facing police authorities. In the particular case of migrants and refugees, there are regular difficulties in accessing health services. And as mentioned by 2 special rapporteurs, the United Nations of Migrants, Felipe Gonzalez, and Maria Gracia Jan Marinaro on trafficking in person, the states should also take steps toward the regularization of undocumented migrants whenever necessary, in view of facilitating their access to health services during the fight on this pandemic. Therefore, it's important to grant migrants access to and healthcare regardless of their migration status. And in particular, for young women and girls, they need to have access to sexual and reproductive rights despite the crisis. As we move forward to today's webinar, it's important to keep in mind the purpose of this meeting. We will need to discuss the current situation of youth and specific actions in regional and global contexts. This will also be a space to share and discuss from our point of view priorities, challenges, and opportunities. At the end, identifying concrete proposals and recommendations for stakeholders. Workshops, spaces, and webinars such as this is a reminder of the importance of continuing to listen to youth voices and support youth-led projects such as Code Weekend, Youth Alliance for Safe and Healthy Homes Suriname, and Youth for Peace International. We are leading up to the high-level political forum and its first virtual session. As youth, we are reinventing ourselves and seeking ways to lead local actions. Let's continue this work and make our voices heard. Thank you very much.
Thank you so much, Maria Corina, for these really great words about youth empowerment and the importance of making our voice heard, as well as all the awesome initiatives you highlighted. I will now go and introduce the second speaker. The second speaker is Mr. Ashraf Nour, who is the director of the International Organization for Migration Office to the United Nations in New York. He has held this position since 2015. In this capacity, Mr. Nour oversees IOM's strategic engagement with the United Nations system, member states, and civil society. In addition, he leads IOM New York's policy development work, the Global Compact for Safe, Orderly, and Regular Migration, and supports IOM's engagement in current UN reforms. Furthermore, Ashraf has led and continues to facilitate IOM's entry into the United Nations. Mr. Nour has 25 years of work experience in diverse positions at both headquarters and field level, working on policy development as well as crisis management and post-conflict recovery. Prior to this current appointment, Mr. Nour was IOM's regional director for Eastern Horn of Africa from 2013-2015, regional representative for East and Central Africa from 2007-2012, and special assistant with the Office of the Director General from 2006 to 2007. And he has also worked with the United Nations Development Program as a senior recovery advisor at the Bureau for Crisis Prevention and Recovery in Geneva. Mr. Nour, you now have the floor.
Thank you very much, moderator, and hello, everyone. I am very pleased to be joined by all of you and together discuss the topic. It is indeed a pleasure to do so in the context of the ECOSOC Youth Forum, and as we all get prepared for the upcoming HLPF meeting in July. We are also delighted to co-host this event with the UN Major Forum for Children and with the UN Major Group for Children and Youth. And it will give all of us the opportunity to have a glimpse into the future, a future led by youth and empowered by technology. In the next couple hours or so, you will have the opportunity to interact with a good mix of experts on the topic, young migrants, UN partners, and many others, and jointly to try to draw a set of recommendations and follow-up actions that we will try together to put to good use. Until we get to that point, I would like to make two main remarks. The first one is about the challenges faced by young migrants during the COVID-19 epidemic. And the second about supporting youth and get their voices heard. On the first one, let me begin by saying that data is really one important thing that we do at IOM. It is a fundamental piece of our work, and we use data in different ways. We use it to facilitate safe, orderly, and regular migration, to support evidence-based exchanges on migration issues, and to design innovative and practical migration solutions. And at these testing times of COVID-19, again, we need data to reset our priorities and have more focus on vulnerable migrants, on migrants in vulnerable situations, migrants that have critical need to access important services, education, health, employment, etc., and migrants who are desperate to keep their livelihoods. Clearly, the COVID-19 situation is impacting all of us, and is doing so in different ways. But among the most hit by the pandemic is certainly mobile population, including refugees and IDPs. And especially the refugees and IDPs, many of them are locked down in camps or camps-like situation. Many other people on the move are stranded and they cannot continue their journeys. And even worse, some of them are in detention situation. So given all that, we need to really look in terms of response, not only to the health emergency part, but beyond that, we have a socio-economic impact that is likely to continue with us for some time to come, and could negatively affect, people rights in terms of access to employment, health, and education. So this is what we need to figure out in the next 1 or 2 years to come. And the UN is already working with that. IOM is part of that process, and also many of you. To have a better understanding of the challenges that we are facing, we need to have a close look at young migrants and how they come into this. And the starting point is to realize or to understand the magnitude of the problem as far as young people are concerned. Their numbers are estimated to be around 56 million people out of the 272 million international migrants. So in terms of percentage, they represent 21% of the total international migrants. So that is a sizable group that is already in that situation. And it's not just the numbers, they are affected by many complexities. And this is what now I would like to touch on, because among these complexities, the fact that they are affected by what I call double vulnerability. In the first place as migrants, but also as young people and children. Many of them, they are separated or unaccompanied, so they are away from their families and from the support of their communities. And their protection is either being compromised or lacked. So this is one group that we really need to give a lot of attention in our response and find more tailored solutions to their cases. Beyond that, we have a situation where school closures around the world has really affected many young migrants. In total, as we know, 1.5 billion pupils or students, depends on the level of education that are in, they were left out of school the past 2 months, and for many they will continue to be out of school maybe for some time to come. And that represents 91.3% of all school goers worldwide who are now in that situation. So it's truly troubling, and more so because although the distance learning is available to many, but is not accessible to all. Just to give you an example, 25% of low-income countries, they don't seem to have that option. And the same goes for migrants, even in many host countries, because of their particular situation and being unemployed, being away from community or family support, they may not have that access. So this is one thing that we need to keep in mind. The third thing is the informal economy. The informal economy, at least the experience from the 2008 financial crisis, told us that it is one of the most hit sectors, when crisis come. This time is no different. And many migrants happen to be working in the informal economy, and they started to lose their jobs, their livelihoods are at risk. And as we figure out the socioeconomic response, we need really to give prominence to the needs of this group and see how best we could address it. Another group is young people who have been put at risk of abuse, violence. We know now many people and many households, they spend a lot of time on the digital technologies. Possibilities of going out and going together is not there, and that makes many of the young people, especially the children, out of the eye of those who would usually give them protection, guidance, and support, and thus they become more vulnerable, to abuse, exploitation, and even worse, human trafficking. So this is another thing that we need to keep. So this is the summary of the complexities that we are facing in this situation. As I said, it is important that we start looking beyond the health emergency and figure out how we deal with the socio-economic impact of this crisis. There is already a framework that the UN has rolled out, and there is a trust fund that has been established. So let us together try to explore what we could do for and sure that in our response, the youth are not left out. That takes me to second point about the response and getting the voices of migrants heard. Again, here it is important that we remind the young migrant youth are already engaged in the response. They are already in the front line. They contribute actively to mitigation measures. They are out to support communities and to support families. And they are also contributing to saving lives in many of our societies. And they are among, the most celebrated heroes of this response. So definitely young youth and migrants in particular, they are there, they are engaged. What is important going forward, we need to make sure that they would not be left out or left behind. And here I think what would guide us is the UN strategy on youth, which put emphasis on ensuring that youth voices would not be only heard, but would be understood, and that they would be not only engaged, but also empowered, and that they will be not just supported, but also leading. So this is the hope that we have, and this is together we need to push to make that goal be realized. The IOM International Migrants Dialogue in 2019 put a number of recommendations that put emphasis on unlocking the potential of youth in response to the migration opportunities and challenges. I think there is no time more where this is needed to unlock the potential of youth so that they are more enabled, they are more empowered, and that they are more engaged in the response. Let me end by making an urge and an appeal to all of you to work for the youth together and to work with the youth and to support the activities carried out by the youth. I think this is a commitment that will bring us together as we go forward, and the IOM commitment here is to work with all of you towards the realization of this goal. And I thank you as I end for this opportunity, and I look forward to the report from your meeting. Thank you, and over to you, back to you, moderator. Thank you very much.
Thank you so much, Mr. Nour, for highlighting some of these really important complexities and the role of youth in the current and work and then in the next steps. And thank you so much as well for, we really value IOM's support and partnership, which you have shown over the years. So thank you so much. So yeah, over now to the third speaker, Ms. Marija Vasileva-Blazev, who is a special advisor to the UN Secretary General Envoy on Youth since November 2019. Prior to this appointment, she has worked for over 10 years as a technical specialist in adolescent and youth health and development with the United Nations Population Fund, Division of Arab State, Europe and Central Asia in New York, the Regional Office of Eastern Europe and Central Asia in Istanbul, and the Pacific Sub-Regional Office in Fiji. Since 2000, she has worked in a non-formal education and capacity building in the civil sector, especially with youth-led and youth-serving organizations. And prior to joining UNFPA, she worked at the Health, Education and Research Association in the Republic of Macedonia and with Family Health International in the US, where she supported behavioral change, communication, and youth participation initiatives related to gender and youth, HIV, STI prevention, youth peer education programs, and youth participation. It's great to have you here today. Ms. Vasileva-Blazev, you now have the floor.
Hi, thank you so much. And Marija, it's good, Marta. Thank you very much. Thanks for the previous speakers and their great insights. And also, let me start also by thanking the Global Youth Caucus on Migration and IOM New York for organizing this consultative webinar, and to all other partners who will contributing to the thematic and breakout sessions that will follow this brief opening. I'm very glad to participate today on behalf of the Secretary General's Envoy on Youth, who unfortunately couldn't join. One thing that it's very clear is that although the world seems to be at a standstill, it is important that we keep up momentum and move ahead on the path we have set out. Even though the ECOSOC Youth Forum and the Youth Plenary couldn't happen in their originally planned format, that we all worked hard towards, but COVID stood on that plan path. I think it is really important, and I congratulate you for taking the initiative and ensuring that the conversation continues and that the youth dialogue and this kind of consultative virtual webinars and events will greatly contribute to bringing the youth voice on various issues to the HLPF this year. The UN Youth Strategy Youth 2030 recognizes that we must work together in intergenerational partnerships to amplify youth voices in intergovernmental processes, especially those representing the most marginalized. And the active participation of youth migrants, refugees, and IDPs in policy dialogue, social justice, inclusion, and social cohesion is very much needed. Policies, there is no other way. Policies must be designed and implemented with the participation of young people, taking into consideration their needs and experiences. Today's event and facilitating discussions to gather input that can fit into the HLPF on issues relating to young people on the move is therefore of a critical importance. It has not gone unnoticed, and it is clear that the product of it's a product of a great team effort. So that's really wonderful. If the current global situation caused by the COVID-19 pandemic has taught us anything, it is that existing vulnerabilities and inequalities are exacerbated in times of crisis. The situation for the most vulnerable in our societies becomes even more challenging. The impact of COVID-19 are and will continue to be felt most harshly by young people already living in difficult and disadvantaged circumstances. And this includes young migrants, refugees, and IDPs who suffer disproportionately, both from the pandemic and from its aftermath, whether because of restrictions on their movement, close living conditions, lack of access to healthcare and other services, fewer employment opportunities, inability to return home, or increased xenophobia. It is also the case for young people separated from or unaccompanied by or left behind by migrant working parents who face higher risk of exploitation, violence, and mental health issues and have limited access to health services and protection. The situation of migrants and instances of discrimination against them have been exacerbated in the time of this crisis by misinformation, fake news in the media, especially social media, and the politicization of the issues. We have seen the pandemic exploited by anti-migrant, far-right, and hate groups pointing to migrants as the cause of the outbreak. This is extremely worrying, and not just because it is untrue, but also because it supports a widespread and largely negative narrative of migration and migrants. It is my hope that the consultations today will address these issues across the three themes and discuss strategies for how we can promote more positive stories of young people on the move. In time of crisis, they're amongst the most resilient and resourceful, but hardly recognized as such. I also hope the discussions will consider the fact that migration in all its facets is highly gendered, with gender roles, relations, and inequalities influencing who migrates, why, and how they move, and where and in what situations they end up being. Marija, Corina mentioned some of these dimensions earlier in her remarks. Let me share a few observations, food for thought, if you will, relating to the themes of today's consultation, the three topics. Firstly, on health risk and opportunities for young people on the move. Young migrants, refugees, and IDPs are often prevented from accessing essential services due to legal, documentation, linguistic, or safety barriers. This includes access to sexual reproductive health and rights services, which has severe consequences, especially for girls and young women. We have heard over and over again that the gender-based violence has been really on the rise during this pandemic. On the other hand, some medical doctors, nurses, and other healthcare professionals are also young migrants, and their job contributes greatly to society's health and development. During the current crisis, the health sector has become the largest employer of young people, and employment rates in this sector have risen faster for young people than for any other age group. This trend is reflected in most countries despite the socioeconomic context. Some countries, there are good examples by temporarily granting residency rights to all migrants and asylum seekers in an irregular situation to give them full access to the country's healthcare as the outbreak escalates, thereby reducing the risks for wider public health. And others have made all coronavirus treatment free to all. I hope that in your discussions you will reflect on the existing challenges for youth on the move in accessing health services, as there is a prerequisite for their ability to achieve their full potential and empowers them to make greater economic and social contributions to their host and origin societies. SDG 3 should be our guiding blueprint and universal health coverage our target. On leveraging technologies, innovation, and entrepreneurship, many young migrants are multilingual and possess important cross-cultural skills and knowledge. They are entrepreneurs, they have technological expertise, motivation to engage with their communities, and clear aspiration for a better future. Promoting entrepreneurship is increasingly viewed as an effective approach to overcoming some of the challenges of economic and social inclusion for migrants and refugees. Support to entrepreneurial activity by and for refugee and migrants contributes to the economic well-being of the individuals themselves and that of the communities in which they reside or originate from, with broader positive social impacts. One important aspect with regards to challenges in access to and sustained education and skills development has become even more obvious during the COVID pandemic. And Mr. Nour alluded to the lockdowns, to the school closures, and how that has affected the continuity of educational activities and skills development. In your discussions, I hope you will reflect on these issues and come up with suggestions for conclusions by various stakeholders in order to achieve the full potential that young people on the move have through leveraging technology and innovation. And thirdly, more specifically on COVID-19, it is clear that migrant youth are at the heightened risk to the immediate and secondary impacts of COVID-19. And while the drivers of migration vary, many young migrants leave home in the search of better employment or better education, which have been largely impacted with this crisis. A global recession will have a consequence, especially on young people's livelihoods, and they will be disproportionately affected. The numbers are really not very positive. And what we learned from the past, for example, after the 2008 global economic and financial crisis, rates of global youth unemployment rose faster than those of adults and took significantly longer to recover. So the effects of the current economic crisis are likely to be similar and long-lasting. Financial insecurity, poverty, and marginalization are often drivers of labor exploitation, including human trafficking, of which young migrants are particularly at risk. In addition, they are often excluded from national social protection measures, which are very important to ensure their livelihoods, their well-being, and their protection. Young people who disproportionately work in the informal sector are more likely to be excluded from public policies and stimulus packages addressing the economic impact of the pandemic, despite we heard some of the good examples that come from different countries. In conclusion, young people are facing the challenges of migration and displacement at a time of intensive cognitive, physical, and social development. And many of us here are migrants ourselves, or we have friends, relatives who are, and can testify that it is never an easy decision to leave everything you hold dear behind, to embark on a journey looking for better or different opportunities for you and for your families. The challenges are many, but so are the opportunities, and young migrants, refugees, IDPs have the potential to contribute positively to origin and host communities, improve international responses, and help build solutions. And they already do. So we need to provide space to hear those solutions more, to invest in those ideas and creative, innovative suggestions so that we really build better post-COVID And we build with the lens of inclusion, with the lens of meaningful participation and engagement by young people, including the young people on the move. So the impact of COVID, what has shown really is that we are far from implementation of the SDGs. It has exposed so many vulnerabilities, and we have entered the decade of action in a critical time, which is the time to scale up solutions, to accelerate progress by seizing the opportunities offered by the migration and by the young people on the move. And I really hope that the consultations will present key actions and recommendations as a forward-looking, youth-focused, youth-generated, and youth-led input to the HLPF. I wish you wonderful discussions, rich deliberations, and I'm sure that what you will present tomorrow as a follow-up of your hard work today in the breakout groups will be meaningful and will greatly contribute to shaping the policies, shaping the responses, and shaping the building back better process much better. Thank you so much.
Thank you so much, Marija, for these great words and for highlighting the global situation, the vulnerabilities, the risks, but also the opportunities that we're facing right now, as well as highlighting the importance of this space, of the outputs that we'll get out of these discussions. And thank you so much for the role that you played in making this possible. And yeah, thank you so much again, Marija. Thank you so much, Marija, Corina.